Hi, how are you, Trey?
I'm doing amazing, and I'm so glad that you're here. This is something I've been seeing in terms of the ads we've been running. But before we get into the campaign, I really want to hear about your background. What brought you to the Department of Health?
Yeah, Trey. So I've worked in public health for about 10 years, doing health education and promotion work. Actually, my first job in grad school was actually working on tobacco marketing campaigns with youth so that they were working to do similarly to this campaign. They think they know you. Really working with their community members to get them to understand how the tobacco industry targets African Americans to get them to start using their products. And I came here to Washington State Department of Health by way of Harris County Public Health in June of 2021.
Wow, so you've been there for a couple years
Been here
now.
for 2 years now.
Yes, settled in to Washington State. But, this is some really specific work y'all are doing, and there's so many different things to tackle in your role. Give us some of those highlights about how you bring your brilliance to the role and to Washington State.
Yeah, so a large part of my role as the director for the Center for Health Promotion and Education is to oversee the agency's public health work. And so our social marketing campaigns, they think they know us. You may have seen a lot of the work around COVID-19. If you saw any of the Vaccinate Wall, we did a campaign that was focused on African Americans to increase our COVID-19 vaccination rates. That was called We Consider, and so it was focused on trying to tackle the vaccine hesitancy issue that many African Americans have and many other, communities of color when it comes to getting real information, right? So we know that with social media and other things, there's a lot of misinformation and disinformation that's out there that specifically targets communities of color that contributes to some of our poorer health outcomes. And so a large part of my role in working with my team is to make sure that we are addressing those issues and bringing accurate information to those communities in a way that is palatable for them, that relates to them, that gets them the information that they need.
Yeah, this is so important.
Yeah.
To be honest, I'm always talking about the fact that as a comms person myself, like there's something very specific about how the community gets to engage with the work, no matter what level of government or what industry. There's something specific about the outward messaging. How have you been intentional when you talk about creating messaging that's palatable for global majority communities?
Yeah, so a large part of that is working with actual people from the community. So one of our partners here is the Anchor Group, which is a Black media company here in the Seattle, Washington area, as well as partnering with other organizations that actually represent the people from those communities. And so in working with them, they are able to sort of reach folks in a way that I think when you put on your government hat, right? So people are like, oh, you work for the government, and maybe a little bit more resistant to actually coming and engaging with us. And so by partnering with folks who come from the community, who look like them, who talk like them, who understand some of their reservations, and trying to take whatever public health action we're trying to, messaging we're trying to get to them, I think that it builds a relationship of trust. And so it's something that's created by people, kind of what FUBU, for us, by us, right? So it's kind of taking that concept to public health messaging and public health marketing, which I think we have been able to show through our partnerships with the Anchor Group, that when you are doing things that are authentic and actually resonate with community, you are able to help them move and practice positive health behaviors.
Yeah, and obviously that's got to be one of the major outcomes, right, that you're looking for with these campaigns. How are you able to deduce some of the data and analyze how these campaigns are, being effective out there in community?
Yeah, so we use some similar tactics that your general marketing will use. So looking at engagement, so how are people interacting with our, material on social media? Are they resharing? Are they, posting? Are they going to the links and the websites that are a part of the advertising to get them to that information? And then there's data, right? So for example, when we did the We Consider campaign, we knew what our COVID-19 vaccination rates were in the African American community in the state of Washington. And so we were able to track over time for the launch of that campaign to sort of the conclusion of the campaign, were we seeing an increase in people who were getting vaccinated? And we did see our numbers increase for African Americans getting vaccinations. And so it's really working with Anchor Group, working with other, Black-based organizations or community-based organizations, and having the boots on the ground, just having, one-on-one conversations with folks. I have attended events with Anchor Group that they've sponsored and just been able to talk to people. And I think for them to be able to see someone who looks like them in this role actually caring and wanting to make sure that where we're spending our dollars, like we're spending our dollars where we say they need to be invested into communities so that people can have informed decisions.
Yeah. Critical messengers are also key to this work. I mean, you just talked
Yes.
about something I was definitely going to hit on, because building the trust, particularly in Black communities, from my perspective, that is one of the biggest hurdles that I think any type of governmental agency has on their shoulders, in a sense, because we're also dealing with historical harms. And, honestly, folks are just like, oh, as soon as they hear that this is coming from a governmental body, oftentimes they shut down. So it's important that folks like yourself are present in community to not only just build the campaigns, but be in relationship. We talk about that, the difference between being transactional and relational all the time, and understanding in a role like yours, there's work you have to do, absolutely, but I love hearing that you're also intentional to be at these events and to be present so that people can ask you questions and you can be accessible to them. That's really key to this. Now, this campaign, it's a beautiful campaign, honestly. I love the commercial, and there's some intentionality y'all put here because, again, we're talking about, a young brother. You see him go into the corner store, and immediately it looks like he's trying to pick out some type of tobacco product.
Yes.
Tell us about how y'all came up with the concept to work with not only the Anchor Group, but to partner on this concept to showcase it's not always what folks think it is, and also the name, they think they know you.
Yes, and so that the actual media and the collateral was designed by a Black media firm. I am going to give you the name later. And so they came up with the concept. They designed it. They tested that with people from the community to see if it resonated with them. And I think the point of the campaign is, we have devices that we have every day in our hands, and they collect data on us all the time. And that data is what the tobacco company uses, and other companies, Nike, everybody else. They use that data to be able to market their products to us. And I think in that commercial, when you look at it, it's just an everyday person, right? You can see yourself walking down the street, connecting with your community members, saying hi to the lady selling flowers or whatever, street vendors, people out there making an honest living, right? And so you're connecting and engaging with folks every day. And then you go into what are typically found in Black neighborhoods, right? A corner store, where most people, that's maybe one of the few things that they have access to in their neighborhoods. And you see the young man going and picking things, and the person's thinking like, oh, you must want these cigarettes. And he's like, no. That's not what I'm looking for. I'm here, and it's just showing the connection between your community and your environment and how the tobacco industry tries to market products to us in order to, get us hooked to a product.
Yeah. Well, that's one aspect of this campaign. Tell us more about how y'all have flushed out some of the opportunities to create content. And also, in your role, the education piece that, folks can tap in with, when they go to the website. What more can they learn about how the tobacco industry utilizes certain tactics to try to market to us and get us hooked on these products?
Yeah, so if you want to know more, you can go to theythinktheyknowyou.org, which has tons of information and resources. It talks about how the tobacco industry in particular targets African Americans, and particularly using menthol tobacco products, right? So those menthol tobacco products are almost kind of like a flavored cigarette. So by FDA rules, that you're not allowed to have add flavors to tobacco, but menthol is one of the only ones that's acceptable per FDA rules. And so what menthol does is it creates a cooling sensation. So it makes it easier to smoke. It makes it easier on your lungs. It's not as harsh. And so people may have a misconception that this is not as bad as cigarette that doesn't have menthol. And so they continue to use the product and become addicted to the product. And menthol products in particular have been targeted to African Americans probably since the 50s. And within our state, when we were doing research, we know that about 5% of the state's population is African American. However, those persons in our state who report being tobacco users, they're 4 times more likely to use menthol products, and about 56% of them actually report using menthol cigarettes. So it's something that the tobacco industry tries to market, obviously, to African Americans. It's been done, but it's a product that kills, so they got to expand their market, right? So menthol products are attractive to younger folks, to youth. They're trying to start advertising and promoting to the LGBTQ community, the Latino and Hispanic community, so that they can really get a customer that's hooked for life. And research has shown that menthol cigarettes are actually harder to quit than your regular, non-menthol tobacco product. So it's really something that they have been genius in doing and trying to, make sure that our community maintains a sort of loyalty, shall I say, to menthol cigarettes, and not necessarily being able to break that habit when people want to quit. But I think if you go to theythinktheyknowyou.org, there are resources out there. The 1-800-QUIT now is a resource that you can use. There's resources for young adults who are using menthol products or any type of tobacco product specifically. And so I would encourage folks to go to the website, learn more about the tobacco industry and how they are specifically targeting you to get you to start using a product that they know is harder to quit. They know that once they get you hooked, they kind of have a customer for life.
Wow. Remeka, thank you so much for your work. Of course, you just gave us all of the great links, but I still got to give you time to look right there in that camera. Let them know if they want to connect with the Department of Health, what y'all are doing in terms of this kind of very specific, intentional messaging. You can look right there. Just let them know how they stay plugged in and connected.
You can stay plugged in. So you can follow us on any of our social media sites. It is WA, DOH, on Twitter, Facebook, Instagram. And then in particular, you can go to theythinktheyknowyou.org if you are looking for resources and more information on menthol. If you would like to get to know more about my team in particular, the Health Promotion and Education team, you can always reach out to me. My email address is remeka.jones@doh.wa.gov.
Remeka, thank you so much for being here and shining a light on this campaign and for the work that you're doing at the Department of Health. We appreciate you.
Thank you so much for having me.
Absolutely. Oh, y'all.